Tiger Woods put out a statement saying in part that he was not drunk, writing, quote, "I want the public to know that alcohol was not involved. What happened was an unexpected reaction to prescribed medication. I didn't realize the mix of medication had affected me so strongly." Dr. Anita Gupta joins me. She's an anesthesiologist and pain specialist and the perfect person to talk about this. Dr. Gupta, thank you for your time. We heard that statement from Tiger saying that he was on a mix of drugs. He had actually told the officer he was taking Solarix, Vicodin, Torix, and Vioxx. I know what Vicodin is. I think most people are familiar with it. But can you tell us about the other drugs, what they are used for?
So there are definitely some concerning medications here. So first of all, there is a misspelling in some of these medications. So nothing that really is alarming, but he is taking NSAIDs. Anything that you would really see with an athlete that has had multiple surgeries, you typically would see anti-inflammatory medications. Vioxx and Toric looks like it's a misspelled medication. We would see this. But the Vicodin is what is really concerning, a typical opioid medication. And as you know, Michaela, we're in a nation of crisis. There is an opioid epidemic. The Surgeon General has put out multiple statements. The CDC has put out multiple statements about how opioids are killing a new generation of people. And as a pain doctor, patients are coming into my office asking a lot of questions. And we need to do a lot for these people who have chronic pain. And really, Tiger Woods is collateral damage of this opioid crisis and a healthcare system that's not doing enough.
Well, and that's a very good conversation that we've been trying to have here on our air about the opioid epidemic and the fact that many say that it starts in the doctor's office, those prescriptions. Now, I do know there is a warning on the label, Dr. Gupta, of the pain medication, and also the pharmacist, depending on where you live, will do a consult with you about how the drug may interact with other things, and that they urge you not to operate machinery or drive, et cetera. It might cause doziness. But what more needs to be done?
So number one, this is something I tell my own patients, ask those difficult questions. Speak up. Patients are in the best position to empower their own health. So ask those hard questions. Their drug interactions can happen even if you're taking normal medications. So ask those hard questions. Even ask your pharmacist, ask your doctor if you're taking any medication, whether over the counter. Number two, if you're taking a pain medication, specifically an opioid, know how much you're taking. Always take what you're prescribed, and if you're taking any heavy machinery or if you're driving, be very, very cautious, and you really shouldn't be using those medications when you're using heavy machinery or driving. And drug driving is real.
Let me ask you one last question about Tiger specifically. We know he has had several back surgeries. I think his latest one, most recent one, was last month. Is it pretty standard that somebody would still be taking that pain medication a month after surgery?
According to the CDC, 3 days is the typical limit that people should be on opioids. Now, within reason, people have chronic pain much, much beyond that. So I don't know his medical history, and it's hard to say, but people do have chronic pain. 100 million people have chronic pain in the United States that require pain medication. So yes, it could be legitimate. It could be legitimate. But
well, folks are struggling. Look, pain is so fatiguing. It interrupts your quality of life. We know that, and there's got to be solutions. But it also, we have to make sure that we address this chronic, or not chronic, this epidemic that's happening in our country. Dr. Anita Gupta, thank you for your expertise and for joining us today.
Thank you so much.
So